Hi ma'am, I am Jessica Peterbar from Lesson 2A. Today I am going to demonstrate or to perform about the oropharyngeal, nasopharyngeal, and tracheostomy. To define suctioning, it is the aspiring secretion through a catheter connected to a suction machine. The purpose of suctioning to maintain oral or nasal hygiene, also the removal of blood and vomits to the patients po. Before the procedures, I will determine the needs for suctioning, administer pain medication before suctioning po. And before explaining the procedures, I will be verify the client and I will be introduce my name, myself to the client. And after na po is mag-explain na po ng procedures po. And assemble the equipment or gather. For the materials or equipment, we have sterile gloves, suction catheter, stethoscope, the clean towel, and the sterile container, the basin, and next naman po is mag-perform na po tayo ng hand hygiene. After po mag-hand hygiene, mag-place po tayo ng towel sa chest po ng patient po. Turn on, and next naman po is turn on suction to the appropriate pressure po. Assuming po ito po yung suction machine, turn on na po natin. Before po sa next procedures, I will be discuss muna po about the wall unit. In the wall unit for the infant, is 50 to 95. For the child, 95 to 110, and the adult is 100 to 120. Sa portable unit naman po, for the infant, 2 to 5 cm mercury, and the child, 5 to 10, and for the adult naman po is 10 to 15 cm mercury. And after po nun is open the sterile suction. Make sure po na hindi po natin matatouch yung sterile part ng suction catheter. And set up na po yung sa sterile container. And dito po sa sterile container, ipo-pour po natin yung saline. And make sure po yung sterile part po ng container is hindi po natin matouch. And next na po nun, nagdadonning na po tayo ng sterile gloves. Yung lalagyan po natin ng sterile gloves is yung sa dominant hand na gagamitin po natin na panghawak sa sterile part or area po. And ito naman pong non-dominant, kahit plain gloves or kahit nga po wala, pwede naman po kasi ito po yung hawak natin sa area na non-sterile area po. After po natin mag-donning ng sterile gloves, yung sterile hand po natin, ito po yung ikukuha natin or ipipik po natin sa sterile catheter po. Ito na po yung sterile suction catheter. And ito na po pong non-dominant po natin. Yun po yung ikukuha natin to the tube from the suction machine. And ito na po yung tube from the suction machine. And ito naman po yung sterile catheter, suction catheter. And iko-connected na po natin to. Assuming na po is na-connect na po natin yung tube, yung sterile catheter, yung sterile suction catheter to the tube of suction machine. Next naman po is i-moisten natin yung catheter by dipping the catheter to the sterile saline po. Then after po natin ma-dip, estimate naman po natin yung distance between the nostril and the airlobe po. And after po nun is mag-insert na po tayo ng suction catheter to the patient po. Make sure na dahan-dahan lang po yung pag-insert po natin ng catheter po. And apply suction using the applying pressure na gamit ko yung pump or 4 fingers po na pang labas po ng pressure po. And make sure po, do not allow suctioning to continue to continue for more than 10 to 15 seconds at a time po. Next naman po is magpa-flush na po tayo ng saline. And pwede naman po tayo mag-repeat suctioning. Depende po kapag gusto pa po or kaya pa po ng patient po. Kapag gusto po ng or kapag kaya pa po ng patient yung procedures ng pagsasuction, allow at least 20 to 30 interval po or additional suctioning is as needed po. Then, after nun po, kapag di naman po nagusto or hindi naman po kaya ng patient na mag-suction ulit, magre-remove na po tayo ng catheter. And gently lang po by rotation po. Rotate or circular motion po yung pag-alis po ng catheter po. And next naman po is, when suctioning is completed po, remove the catheter from the tube po. And isasama na po natin yung sa pagtapon or pag-alis din po ng gloves, ng sterile gloves. And isasama na rin po natin na itatapon or itatapon yung sterile container from the proper receptacle po. Then after po natin matapon, magpo-perform ulit tayo ng hand hygiene. And after po natin hand hygiene, mag-auscultate na po tayo to listen the chest and breath sound about the effectiveness of suctioning po. Then, kapag tapos na po tayo mag-auscultate, i-record naman po natin or i-document the time of suctioning, the amount of secretion na nakuha po natin sa patient, and also the character of the patient during the suction. And after po natin makapag-record ng lahat na ginawa natin sa patient, mag-offer na po naman po tayo ng oral hygiene po after the suctioning. And assuming po oral hygiene na po si patient, and next naman po natin gagawin is yung sa oropharyngeal procedures po. And before the procedures po, of course, we need to gather the equipment po. And next, perform hand hygiene. Open the sterile kit and also the sterile container, and ilalagyan po natin ng sterile saline po. Assuming kung lalagyan na po natin, and make sure kung wag mong itatouch yung sterile part or area ng container po. And after po nun, magdadaling na po tayo ng sterile gloves. And ito pong dominant hand, ito po yung ihawak natin sa catheter or oropharyngeal point. Kung non-dominant, ito po yung ihawak natin to non-sterile area po. Like, assuming na lang po na ito po yung catheter for oral or for the oropharyngeal. And ito po yung tube from the suctioning. And i-connect po natin to. Next naman po is estimate po natin yung distance between the oral to the earlobe po. And after po nun is i-dip po natin or mo-moisten the catheter by dipping to the saline po. And next po natin ma-dip, i-assist na po natin si patient na open yung mouth. Then, make sure po natin na yung sa pinakadulo din po ng mouth is ma-suction po para po makuha yung mga secretion po. Then, assuming po, nakuha na po natin, or na nakapag-suction na po tayo, nakapag-oro-suction na po tayo, and remove na po natin. Remove na po natin yung oro catheter to the tube of suction machine. And remove na po yung gloves with the oro catheter. And itapon po natin sa proper receptacle. And after po nung ginawa natin is magdo-document na po natin or i-record natin yung time of suctioning of the oral and the amount of secretion na nakuha po natin, and also the character of the patient during the suctioning po.